In addition to your myeloma specialist, what other healthcare professionals should you consider adding to your healthcare team?
So besides a myeloma specialist, I think it's important, one, to have your certainly your local oncologist and even your general practitioner on your medical team. Um, you may well have other specialists on your team as well. For example, a nephrologist who specializes in kidneys, a cardiologist who specializes in heart and pulmonary issues, a pain management doctor, because you may go through some pain that they can help you with, a neurologist who specializes in nerve issues and more. They can all play a role in your overall health and quality of life.
Every patient should have a good family practice physician. I'm a little biased, I guess, because for 25 years I was a practicing family physician. But I can tell you that an educated family practice physician can put all of these things together. They can keep track of some of your myeloma treatments. They can definitely keep track of all the other medical concerns in your life, such as your high blood pressure, checking you for diabetes, all of the many things that a family practice doctor can do. It's also important to have a good oncology nurse that you can trust. And that oncology nurse can even help you with things like payment plans, which different companies have for their myeloma drugs. A good specialist myeloma nurse will know these various treatment plans. They'll know the phone numbers to call. They'll know who to contact. So you should get a nurse that you can trust and rely on as well.
In addition to myeloma specialists, there are often, depending on the situation, orthopedists involved. There may be radiation oncologists involved, physical therapists. There are a variety of specialists that may be involved depending on a particular situation. If a patient has significant bone disease, we may need an orthopedist to assist either surgically or assessing. Sometimes patients present in their first presentation is actually with a fracture, and we need to address those situations. So all of those members can be part of the team for a given patient. Integral also to your team and when you're newly diagnosed is not just the team at your site, but actually all of the wonderful resources of the patient advocacy groups and the education resources that are available both through HealthTree, but through the other myeloma foundations that are out there as well too, because it is really critical, I believe, for patients to get good quality information to help, because I believe that knowledge helps deal with some of the anxiety and the fear that comes with a new diagnosis.
So we've had some great success, but the change is so fast that even myeloma professionals, are hard to find and to keep up with all that's going on. So, what you need to do is you need to make sure you have one in your corner, either as a consult for your local oncologist with a treatment plan for your local oncologist, or better yet, one who's providing you with the care. Because one thing for sure, myeloma specialists save lives.
What should Medicare recipients know about financial assistance programs that help with the cost of care?
So I think it's important that people know that there are places available. Drug companies do give it to third parties like LLS, PAN, which is Patient Assistance Network, PAF, which is Patient Assistance Foundation, Assistance Fund, Cancer Care, Good Days, and HealthWell. So all of those are available. What you need to do is to find, I think they get their funds usually in January, February. So you need to get in to those funds in January and February and get into more than one fund, because they'll give you about $10,000 to $15,000 each fund. So, at a minimum, you're going to pay $20,000. So you need to get in the fund, get in it early, and to make sure that you at least have that kind of coverage.